Welcome to another episode of Let's Talk Value in Healthcare. And today I welcome Dr. Ahunna Okwubunka Anim. Welcome, Ahunna.
Hi, Verena. Very nice to be here.
My name is Verena Volter. I'm the CEO and founder of 5P Healthcare Solutions and the author of It Takes 5 to Tango. So people ask me, what the heck is a tango and what the heck are the 5? So I think this is the purpose of this podcast series, to invite some of these experts around the value chain: patients receiving care, providers providing care, pharma developing care, payers paying for care, and policy setting the regulatory framework. So today is a special day because we have a family medicine expert with Ahunna here on the podium. She has trained in family medicine and has really been loyal to her vocation there. But she particularly has discovered value-based healthcare. And in a recent conversation, she told me it's the best thing that could have happened to me in my life. And so I'm very excited to talk a bit. What does that actually mean in daily life, in the clinics, for people, for patients? But I also want to spark your curiosity, because Ahunna is really an expert when it comes to optimizing the digital solutions to the benefit of value-based healthcare and better care altogether. So Ahunna, you know, I always start with this kind of 50,000 birds view question. What does value mean to you in healthcare? Share your thoughts, please, with the audience.
Thank you, Verena. I think this is a good way to start. And for me, value in healthcare is really about proactively improving care for my patients, with an emphasis on their overall wellness, quality of care, preventive screenings, and treatment. So really practicing these care principles, as we know, improves healthcare outcomes for our patients and also reduces costs. The concept of value in healthcare, which by the way begins and ends with the patient, can only be achieved when we have collaboration amongst the main actors, like you rightfully talked about, in the healthcare system, and thoughts benefiting the patients, the providers, and healthcare in general. So let me break it down a little further. Building relationships with my patients, because when I do, my patients are happier and healthier. So it fosters that trust and partnership with my patients. Then it also empowers them that we work together to ensure that that value is provided to the patient and the patient has an excellent outcome. So for instance, when a new patient comes into the office, I want to know who John is. I want to know what John does for a living, or what he used to do for a living, or what he's striving to do for a living. So knowing that John is 60 and he has suddenly taken over custody of his 10-year-old grandson and wants to be healthy, to ensure that that grandson makes it to college. He wants to play basketball with that grandson. So how do I work with John to ensure that he is healthy, to take care of that grandson and be there for that graduation? So we come up with a plan, a personalized health plan. John has his part to play because he wants to be there for his grandson. And then I have a part to play because I want to make sure that John has that outcome that he so wants to. So both of us working together with him at the center, making sure that we achieve those healthcare goals for John.
And I think you said it so beautifully in a couple of minutes what the essentials of value-based healthcare are. So I think we probably should cut just that little bit for the, for any description when people ask what is this. But what I really love you say, and I'm sure it's going to be music to many ears of many listeners, is you go beyond the patient as a label and you go to the person and the human being behind. And then the second thing that resonates also with me so much is like that doctor-patient relationship, which is the backbone to everything we do. And I love what you say, good relationship. You're happier as a doctor, I think. It's more fulfilling. And then obviously the patient or the person that you're actually interacting with, that you're trying to help. So I think many things you already said in terms of keywords, partnerships, relationships, prevention. Before we go into learning from you some examples on how that really works in terms of digital and smart value-based healthcare. Tell us a little bit in your observation, just a couple of minutes around the problems. So what's actually getting in the way today? What are some of the barriers that you see that then in a few minutes down the road, you'll tell us how you approach them? But some issues maybe you want to share.
So I want to start with a challenging story. I think that will help us understand what the challenges are. So a while ago, I took care of a young man who has a diagnosis of schizophrenia, which, as you know, is a severe mental illness. He's had this for most of his life, Verena, and he became a threat to himself whenever he doesn't take his medication. And this happened pretty often. And then what then happens is there's a deterioration of his mental status. So during one of those episodes, we at the clinic arranged for transportation to bring him in for a follow-up. When he arrived, Verena, he looked pretty bad. So he was pale, unshaven, his hair was tangled, his clothes were tattered. He had a musty smell. He made no eye contact with me as I reminded him of who I was. He muffled a few words, and frankly, I didn't ask for clarification. So the medical assistant saw how hungry he was and brought him some cookies and some coffee, which he ate very quickly. So what has really happened to this poor fellow, I asked myself. He came alone to the clinic. He supposedly had friends that he lives with in a group home that somewhat act as his caretaker. Who is his social worker? We have no records, Verena. Who is his psychiatrist? When was the last time he was in mental health clinic? What are his current medications? Were the medications picked up from the pharmacy? I don't know. If so, when? Does he take his medications, right? I want to know. So we don't have immediate access to these records and have no way of knowing the answers to my questions. So I later learned that he had an emergency room visit and he was discharged, but there was no follow-up. Again, this is something that we deal with, right? Then I began to ask questions. He didn't interact with me. He looked at me with suspicion. And so I looked down at my laptop just for a few seconds, and boy, he dashed out the exit, out to the street. Verena, he ran as fast as his legs could go. He darted through the traffic like an arrow.
This sounds like a thriller.
I'm not kidding you. It was, and then the drivers were yelling at him. Yes, drivers were yelling at him. The cars were honking. And then the traffic halted and he disappeared. And you can imagine the image in my head. And I'm thinking, oh my God, what's going to happen to him? We have an accident, somebody hurt him. So we, of course, followed the necessary protocols. And then the nurse later on confirmed that he ended up in the emergency room with an acute substance abuse from psychosis. So I did call the emergency room physician immediately because that was my time to act and there to find out what had been going on. And I said, he cannot be discharged until we have the proper discharge planning. So a series of events sort of transferred after that. And eventually I ended up speaking with a psychiatrist at about 10 p.m. that night. So we got to talking about his case for about an hour. We talked about the challenges, the limitations, the failures of the system in taking care of patients like him. So we both arrived at an amicable discharge plan for my patient, which was a win, right? But this worked for a while. But now again, we have come back to the broken system. I haven't seen that for months. Yes.
So what we're hearing from your story, Ahunna, is actually, obviously, just to ease the listener, not everything is quite a thriller like your real scenario. You're describing a patient running off onto the highway. But I think what we're hearing you say, quote unquote, beautiful example in the, being using a cynical word here, but a beautiful example of the silos. When people ask me, but why are you talking about silos all the time? I think that's what you described is right. The social worker here, the psychiatrist over there, the caretaker here, the ER doctor over there, you over here, and nobody really knows of each other what has happened to this patient. And unfortunately, in a mental health situation, often the patient cannot help because they can't remember, etc. Somebody with good cognition and, better mental condition is maybe able to step into that coordination role and tell you, well, I have been to all these doctors, but the system doesn't allow it for now to have a connection across all these silos. And the other thing that I wanted to mention here before, obviously everyone is eager to hear your thoughts on, well, what should happen and what can happen to make that a better world. I want to flag something here that you just said on the side note, and I want to give this more, amplify what you said, Ahunna. You said something at 10 p.m. in the evening. You, as the family doctor, you picked up the phone and called the ER doctor and spent an hour. So that is not regular 9 to 5 working hours, even if, you know, you would say you would maybe had a night shift. But I would say we hear a lot about physician burnout and overhour and going that extra mile of somebody like you and the ER doctor just saying, we need to fix this here despite the system not helping us. And I want to flag this to people to hear when you read headlines, healthcare worker burnout, these are things that are adding and that are unnecessary because you're trying to fix something that the system hasn't helped you, you know, across those silos. Just wanted to plug in here a plea and thank you for what you and many other doctors and nurses are doing. So tell us what could happen to make this a better world and, you know, have your patient not run on the highway maybe.
So, Rina, I think I'm going to start with what, to your point, what helped us succeed to begin. We had an app, a patient ping app, which is a web-based application that sort of notifies the patient's physician when they check into, you know, the hospital, a health organization. So that alerted us when our patient was admitted to the hospital, and then we sprang into action. So again, here we have digital helping us out. Then the second thing that helped us was collaboration. You did talk about silos between the various actors. So here, I, the primary care physician, led the collaboration efforts between the actors. In this case, that was the ED physician and then the psychiatrist. And we began as a group to talk about what makes sense. How can we work together to help this patient to get to where he needs to go? Let's talk about why we failed. Well, the healthcare system is built on the wrong incentives, right? So we have a fee-for-service system that is rewarded for volume and not for value, for quantity, not for quality. So the incentives are not built in the system to reward outcomes for patients, providers, etc. If these incentives were in place, we would have had a shared responsibility to begin by the various actors to hold us all accountable for the care of this patient. So the psychiatrist, where he went, the social worker, everybody will have an ownership, and this would not have happened. Again, wrong incentives. Then the next thing is we have a fragmented system, very inefficient and full of waste. So you rightfully said in your book, it's not a matter of resources, it's where are these resources allocated? And the psychiatrist mentioned that during our discussion. She said, we don't have targeted resources to provide essential solutions in mental health. For example, my patient needed to be placed in a rightful place. In that time, there was nothing available. Again, that was a problem. And then the hospital, of course, so many inefficiencies, you know, infrastructures are outdated, processes are all over the place. And it took several calls just to connect to the emergency room physician. Again, poor coordination. And as a result of the interoperable EHR, there we go with the lack of coordination. So this brings me to the solutions that we're talking about, how digital solutions can help with our patient outcomes. Broadly speaking, as you know, some of the potential use of AI include you have to detect, diagnose, manage, and treat medical conditions. For this patient of ours, things like patient engagement, increasing medication adherence have been utilized in the AI space. So electronic health records, if we had an interoperable EHR, the providers will access those records in real time and make life-changing decisions to assist our patients, especially during the course of illness. So without that, we did not know who the psychiatrist was, who the social worker was, where he had been, which medications were ordered, if he were adherent to his medications. Those clinical notes were not accessible. And furthermore, with AI, natural language processing, we would have had the doctor and the nurse rapidly update his medical records, and the computer will be monitoring it and be updating this in real time. We'll have AI listening in, and automatically recording the conversation, obviously with all the approvals in place, right? With regulatory frameworks in place, yes. And the system will be trained and is capturing the essence of the conversation and summarizing it. So now the doctor is actually talking to the patient, staying engaged, being empathetic, and the customer experience, like we would say, or the patient-doctor experience is much better. While in the visit, the medical records are automatically created. This is what is to come, and it's already happening in some places. So that's where AI and natural language processing can be helpful for patients and improving the patient outcomes. Now, smartphone apps and mobile devices. Now we have pervasive computing. Healthcare is provided to everyone at any time. So anywhere, by utilizing these mobile and wireless technologies and broadening both the coverage and the quality of healthcare, the goal is really to precisely and timely get healthcare so that we can integrate all these processes and improve communication of care, which was lacking here, and then enable providers to be more efficient in their internal operations. I'm going to give you an example of a patient of mine who had an Apple Watch, and he sent me his EKG reading on his Apple Watch. He told me this was abnormal. I'm like, okay, send it to me. And I brought him into the clinic, and sure enough, a 12-lead EKG confirmed that he had atrial fibrillation, which is an abnormal rhythm. So we're able to initiate appropriate life-saving therapy for him right away. Now, for this particular patient of mine with mental illness, how will his mobile app help him? It will augment and deliver treatments, for instance, psychosocial interventions, targeting motivation, pharmacological interventions, targeting medication adherence, and real-time location systems such as the radio frequency identification and internal trackers, where wireless tags are attached to the objects, people, and medication. Let me give you an example where RFID now comes into play, digital technology that is meeting medications. So we have the first FDA-approved prescription digital medical system.
Thank you. I was just thinking we should talk about digital therapeutics, DTX. Yes, thank you.
So to help the patient and the healthcare system stay on top of how this treatment is going. So some of them have components. I'm going to give you one, for instance, the pill, the app, the patch, the dashboard, and the conversation. So this digital system, the patient takes a smart pill, which is integrated with, it has an integrated technology like the size of the grain of a sand, believe it or not. So the technology is made up of ingredients that are found in our diets, and we take them. And once the patient takes the pill, it sends out a tiny signal, and the patch gets that signal from the smart pill and then logs it on that he has taken his medication. Like an activity tracker, the patch automatically logs the number of steps he's also taken that day, the time he spent resting, and sends that information via Bluetooth to the app on the smartphone. So that app then records his mood with an emoji, which he can do, and he'll tell you how well he's rested. And the reason, if he didn't take his pill, that will also be recorded. So the app tells you how he's feeling a certain day, how he's feeling a certain week, how he's feeling over a long period of time.
And it empowers patients too, because they can do something, right? They're not like feeling powerless at home, suffering from the disease, but it gives them something to do. And I think, as what you said early on, shared responsibility is also obviously the role of the patient themselves to take action. And I think digital therapeutics in this case are a wonderful tool to be playful and, have the patient being engaged in that discussion. And I think what you really nicely summarized is that the digital component helps for better communication, to bridge the silos with information. Who has the patient seen, when, which medication are they taking? And it empowers patients even become active in their care plan.
And then also this device actually can, allow them to have their family and friends also be a part of their daily data. And that way they can, also be part of the conversation with the healthcare team and his support network. So everybody working together to ensure that the patient is healthy. Great
that
outcomes.
Is nice. I wanted to also put a plead here, which I omitted to say in the introduction, is that Ahunna is not only a clinician and family doctor and general GP basically for many years. But she also is right now a medical director in the IRA Health that is very strong on these digital components and digital health. But she also was smart enough to obtain an executive MBA recently at UNC, Kenneth Flagler School. And I know that she's, got so encouraged by the whole business component of it too, to see, what else can she do, and her peers at the school or from the school to think about, getting some of those startup ideas around digital health into real life. So not saying that everybody must get an MBA degree and not everybody must get a medical director in digital health job, but I think the encouraging word to the audience can be, there are those lighthouse colleagues out there who are able to carry all these hats. So I recommend following people like Ahunna and many other, get inspired and listen to their ideas on how to break down those silos and what is it everybody in the ecosystem can do in their daily lives. And maybe there is an app in your environment, or maybe there are people in your environment that are working on things like that. Be curious and ask them and reach out. So unfortunately, I'm looking at time. That's always kind of the scary moment of this podcast. It's like we could go on for another, I guess, hour. But I think we've touched on many things on what are the ingredients for value-based healthcare and how can digital help to do them. And for the interested reader, thanks, Ahunna, you mentioned, chapter 3 and 4 in my book around those two topics. But I wanted to hand it back to you. Any last comment that we haven't said or that you'd like to summarize to the audience from our encounter today, Ahunna?
Yeah, thank you, Verena. I think, value-based care we need to emphasize is patient-centered and produces great outcomes and decreases overall costs. I think that needs to be clear. And also digital tools such as AI has the biggest potential to analyze vast amounts of data and offer insights to promote preventive medicines, personalized solutions, and targeted treatments. And of course, this facilitates our value-based principles, empowering the patient, which you mentioned. But I do think that AI, in order for AI to succeed, all the stakeholders, here we go with stakeholders, including even the patients, the providers, farmers, payers, and policymakers, need to understand the potential advantages and risks, and then come up with ethical standards that are applicable and obligatory for the healthcare sector. And those need to be created sooner, like you emphasized in your book, than later. Thank you.
Thank you very much, Dr. Ahunna. To the audience, if you liked this episode and if you like the series, as always, please share, like, and you can subscribe to our audio version on the Spotify channel and also to our video version on the newly created YouTube channel, News and 5P Healthcare Solutions. Bye-bye.
Bye-bye.